right, with that, let's have Tiffany Lutz come talk to us about Spur Therapeutics program for AMN. Just as a reminder, they're doing the gene therapy for AMN and looking forward to the update.
Hi everyone, so I come from Spur Therapeutics, formerly Swan Bio, and I'm here to update you on two of our studies that we have for AMN. And so just a little corporate update. If you've heard anyone talk about our program before, it was formerly under Swan Bio Therapeutics, and we were recently acquired by Spur Therapeutics, and that's given us more resources and enables us to continue on with our clinical trials. And the AMN program does fit nicely in with their pipeline, or our pipeline. So they have a program for lysosomal storage disease, as well as two other CNS disorders and a cardiovascular. I'm not going to spend a lot of time on this slide because a lot of this we've already gone over, but AMN is the default clinical form of X-linked ALD. And one thing I do want to highlight is there is currently no approved treatments, and there's a few in development, and it's just standard of care and symptom control. And that's something that we're trying to work out with our SBT101 program. And this is an investigational gene therapy candidate. We use an AAV9 capsid that holds a gene cassette with a functioning human ABCD1 gene. This isn't a live virus, it's just a viral capsid. And this is a one-time treatment. It's infused into the CSF of patients. And this single infusion takes course over about 5 hours, and the patients can remain laying down or they can ambulate. And then they are in the hospital for a couple days to be watched, and then their subsequent follow-up visits. And AAV-based vectors are well suited for targeting AMN. We know that they can transduce relevant regions of the spinal cord, and they generally do not integrate into cells' own DNA, and we don't need them to because the spinal cord cells divide slowly, and so these vector genomes can persist long-term without requiring this need for integration. Let's see. And so, like I said, we have two studies going on. We have our PROPEL study, which is our phase 1/2 clinical trial. That's what I just briefly touched upon. And then we also have our SIGNET natural history study. And both of these studies are conducted very similar, with the exception that the natural history study does not have any intervention. And in both of these studies, we use these wearables to conduct a lot of our physical assessments. So we look at 6-minute walk test, 2-minute walk test, postural body sway, and other physical assessments. And these wearables allow us to collect data both in clinic and at home in the remote visits. And this reduces the patient burden of having to come in frequently for these visits. So in our SIGNET natural history study, we collect data at baseline, 3, 6, 9, 12 months through 5 years now. So coming in every 3 months to conduct these studies is a lot to ask. So having these wearables allows us to do this in the comfort of the patient's home. And we do have key inclusion and exclusion criteria for both of these studies. These studies are for men ages 18 to 65 that need a genetic diagnosis of AMN with a moderate to mild severity. And then we have an exclusion criteria of a history of cerebral inflammatory disease. And then if we're looking at the expanded disability scale for a phase 1/2 clinical trial, it's 1 up to a 4.5, and our SIGNET is a little wider range of 1 to 6.5. And both of these studies have two different study objectives. For a natural history study, we're trying to better understand the symptoms, disabilities, disease progression of AMN. And then this is also going to allow us to establish meaningful endpoints for our clinical trial. This study has 65 patients enrolled in 2 sites, or enrolled in multiple sites across the US and Europe. Majority of the testing, like I said, is collected at home using these electronic data capture methods. And then we do have a flexible visit window timing, whereas our clinical trial, the visit window is very narrow. For this natural history study, it's very flexible in terms of timing. And this study, we did complete enrollment, and we recently extended it for a 5-year duration. So our phase 1/2 clinical study is ongoing, and this study, we want to assess the safety and the maximum tolerable dose and the efficacy of the product in a small group of initial patients. And then this is a one-time infusion, and then we follow up over the course of 5 years. So we have two different cohorts. We have our low dose cohort at which we've dosed 4 patients, and we have our high dose cohort. This shows that we dosed 2 patients, but we recently had another patient dosed this week, so we have 3 high dose patients being dosed. This wasn't updated in time. And then between different milestones, we do have a data safety monitoring board meeting that which are individual members that look through our safety data. So this is a depiction of where we're at in the trial. We have dosed 4 low dose patients, 3 high dose patients. The third high dose isn't on here yet. Unfortunately, 1 patient did pass away, was not due to the drug product or procedure, an unfortunate event. So currently, we are monitoring 6 patients, 3 at the high dose and 3 at the low dose. And we are planning on dosing 2 more patients to close out this phase of the study, 1 more later in this year, and then 1 next year. And so our next steps, we have a lot of work ahead of us. We need to understand our SIGNET data, which is our natural history data, to help us establish meaningful endpoints. We need to review the safety and the early potential signs of efficacy in our clinical trial. We need to optimize the manufacturing for late stage development. That a next phase of a trial would require a lot more participants. We need a lot more drug to be manufactured. And then once we do both of those things, we can progress to a phase 2/3 study, and this would be our pivotal study to support the marketing authorization. So we have a lot of work ahead of us. We do plan on releasing the safety data for this Q2 of next year, once all the patients have been dosed and we gather all of that data. And then a little further out, we will be releasing any potential efficacy results, but that'll be a little bit out. So thank you.
One question, maybe just reflecting my own ignorance. By administering the gene therapy in adulthood, is there a risk that we're missing like a critical window in terms of when it would need to be active to, like if there's kind of a cascade effect of disease?
That is a good question. It's not one that I have an answer to, but it is one that I would bring back to our medical team.
Did you have a question? Yes.
Thank you very much for the update. In particular, interested in the component of monitoring patients through wearable devices. Do you think, from what you've learned so far, that that kind of monitoring could also be transferred to pediatric populations to gather information and also to establish early change and trajectories of the disease?
I'm not sure. In terms of we're only working with adults, we do see, because we're also doing the monitoring in clinic, and we see similar values in the clinic as well as with the device. There are some assessments that don't translate to in the at-home environment, just due to the nature of the assessment. Like our 2-minute walk test, we can compare at-home visit to at-home visit, but we can't compare it to in the clinic, just because we think it's just due to the patient's home. It might not be as easy to walk longer distances with turns and mobility of having to walk in between things. So I guess it depends on what you're looking at, but that would be interesting to see if it could translate to pediatrics as well.
Thank you.
And we have another.
I just wanted to double check. You had two different Propel and Signet, and I saw that if they have a history of cerebral, is it for both that they cannot?
It is for both,
Okay.
because we are using the Signet study to gather information on endpoints for the clinical trial. So we'd want to mirror the population that we're studying as closely as we can. We have had patients that did convert over that we still are in the study, but it is a exclusionary for both studies.
For the clinical
For the
study?
clinical study and natural history, yes.
Okay, thank you.
And we have one more. Sorry, we have one more online question. Do you expect for female studies to follow at some point, or is that part of the long-term?
That would be part of the long term, but right now we're just trying to get through this to move on to a pivotal, but it is in the thoughts of us at Spur.
Excellent. Any other questions? All right, well, thank
Thank
you
you.
so much.